Hello everyone, my name is Devyani and I am one of the junior doctors working at Lakeside Surgery. So we asked you what some of the reasons are for not attending or delaying your cervical smear through a survey. I am now going to go through some main questions and comments that were asked in the survey. Thank you so much for responding to the survey if you did, and all the comments and points of discussion were incredibly useful. So one of the comments was, I would like the cervical screening check not just for HPV, but also to check the cell morphology, even if the HPV test result is negative. Okay, so as you may be aware, the UK has moved to HPV primary testing in the cervical screening programme. So what that means is that the sample will be tested for HPV first, rather than cell changes first, which was done before. You might be wondering why this has changed. HPV, we know for a fact, causes 99.7% of cervical cancers. So testing for HPV means that we can identify who is most at risk of developing cell changes, and then we can give the right people the care they need as early as possible. And 15 years of evidence-based medicine and randomized control trials have actually shown that this method saves more lives, which is why a lot of countries are now opting for these methods. Anybody whose sample is HPV positive, then your sample will be checked for the cells, and anybody with abnormal cells is invited for a colposcopy for a closer look. Another comment that was made is screening service should be extended to people younger than 25. So you won't be invited for cervical screening until you're 25, because cervical cancer is incredibly rare for someone under 25. And a lot of research has shown that it might lead to having treatment you don't necessarily need. In the majority of cases, abnormal cell changes often go back to normal in younger women. However, if you do develop symptoms that you're worried about, you should definitely book an appointment with your GP. I've also spoken about some of the symptoms of cervical cancer in another video. Another comment that was made is, I had panic attacks during my last smear, and now I'm too scared of that happening again. Self-sampling at home would be the best development for me. Okay, firstly, I'm incredibly sorry to hear anyone having a bad experience with previous smears. I have made another video on how to help make the screening process easier for you. And secondly, 10% of responders from this survey also wanted the option of a self-sample kit at home. Now, there was a study conducted in London last year where they were sent self-sample kits for HPV testing at home, and 31,000 women were involved in this study. Hopefully the results of this will mean that anyone who wishes to will soon be able to have the option of using a self-sample kit. Unfortunately, this study is currently only running in North and East London, and it is essential to ensure that they are introduced in the safest and most effective way once the results of the study are out. To get more information, I have created a guide to cervical screening document, which you should be able to access electronically. Thank you so much for listening, and don't forget to book your smear.